Hi, welcome to the Addiction Recovery Place podcast, the podcast champion addiction treatment professionals around the world. I'm your host, Chris Langley, and I'm very pleased to introduce today's guest, Christine Martinek, a licensed drug and alcohol counselor from the Senior Recovery Center in St. Paul, Minnesota. The Senior Recovery Program is a state-licensed outpatient substance abuse clinic that has been providing recovery service for seniors for 47 years. Welcome to Addiction Recovery Place podcast, Christine. It's great to have you here today.
Thank you. Thank you for having me. I feel very blessed that you called and asked us to be a part of this.
Oh, I really appreciate that. And I was very
Yeah.
excited when you accepted the invitation as well, because as soon as I saw what you do, I thought I've got to speak to these people. And I'm so glad that you accepted the invitation.
Thank you.
And we're going to tell our audience about the wonderful service that you provide your clients today. So first of all, Christine, tell us about yourself and how you became a counselor and working at Senior Recovery Center.
So I grew up in a family where we had a lot of addiction issues, from grandparents down to my mother. And so I seen a lot of issues, and I experienced a lot. And as I got older, around my 30s, I started to develop some addiction issues myself that were overwhelming, and I needed to get some support. So I actually entered treatment services at St. Joseph's Hospital, and I decided that I needed to do something with my life, to move forward and to make changes. And so I decided after I graduated from treatment that I wanted to help other people that were just like me. I'm sure you hear that a lot, but so then I entered into the Associate in Human Service program at Inver Hills, and I went on to Metro State University, where I got my LADC license. And then I had done my internship at Senior Recovery Center. And so when I came here, I really developed a connection with the older adults. And I've always had a passion for wanting to work with older adults, because I did work for an assisted living home for many years as a resident assistant, and I passed medications. And so I just love older adults and seniors. So they asked me to stay on and be a counselor here, and I'm still here. I haven't left. So here I am. So that's how I got here.
Well, congratulations for everything you've achieved
Thank
so
you.
far. That's an amazing story, and
Yeah.
it's something unique as well. And what you've done is pretty remarkable. So
Thank you.
definitely big congratulations for that, Christine.
You.
I love the quote on your website, and I'm going to read this to the audience. We practically wrote the book on seniors and addiction.
Sure.
Wonderful. Can you tell us about the history of the Senior Recovery Center, please?
Oh, definitely. I just want to say, too, that Senior Recovery Center is one of the only older adult treatment centers in Minnesota. I mean, there's a couple more. There's one more that I can think of, but they're not a licensed 245G program. So they have different paperwork and have different approaches. For us, it started probably about in the late 70s. And what happened is there was, in St. Paul, there was a lot of high rises going up. And so a lot of seniors, they started St. Joseph's, which was a staple to the community, the hospital. And one of the oldest hospitals here. And so they started to see an increase of seniors coming in with substance use disorder, so alcohol mostly. And so they contacted a gentleman by the name of Tom Gerens. And he was a counselor, and he decided to work with St. Joseph's, and he started the Senior Recovery Program. So what they would do is they would go out and they would visit these seniors that they were seeing in the hospital. They would visit them in their homes or their apartments. They would invite them to AA groups. And so that's kind of where it all started. And it just kind of developed from there. And I believe in the early 80s, it turned into a nonprofit. And so that's and then they started to just bring people in, and the seniors were becoming so involved, and they felt a real connection at Senior Recovery, because one of the main things that that sets us apart from everyone else is that when our seniors or older adults are in group, they're sitting with people their own
Yes.
age,
Yeah.
right? They're connecting with people that grew up like the same
Hmm.
music, the same era, a lot of the same
Hmm.
beliefs. Because if you think about it, 70 years ago, church was very
Hmm.
important. I mean, there were a lot of things that were, going on at that time that all of these people grew up with. There was the war, there was, a lot of different things. So when they're sitting in group together, they can really connect with each other, and it's a lot different than the culture
Yes.
nowadays. Uh, so I'd say pretty much that's kind of the main. It's the camaraderie that they have here, and I believe that's why senior recovery has made it so long. Yes.
Amazing.
Yeah.
Absolutely amazing. Can you tell us about your team that you have at Senior Recovery Centre and the roles as well? That'll be great to hear.
Sure. So we're kind of a smaller treatment
Hmm.
center, but Mary Selsky is our CEO and
Hmm.
director. She's been with Senior Recovery for many
Hmm.
years. I believe it's 16 years now. And so she's kind of seen a lot of changes, but she's helped really keep this program going, because a lot of people don't know this, but once someone turns 65 years old, their insurance turns to
Yeah.
Medicare. Now, Medicare does not really focus on substance use
Hmm.
disorder, so there's not a lot of support for our seniors. So once they turn 65, Medicare does not cover the cost of treatment services. Yes, it's insane.
Wow.
Yep, unless you yes, it's
Yeah.
like no one knows how horrible that
Mm.
is for somebody who calls up and says I need
Mm.
help, and they're 65 plus and Medicare won't cover the cost. And none of the treatment centers are accepting Medicare. And so a lot of these seniors that are on a limited income have to be private pay.
Mhm.
And a lot of people don't have that kind of
Mm.
money to pull out of pocket to pay for treatment
Sure.
services when you're trying to buy
Yeah.
food or pay
Yeah.
bills.
Mhm.
Yeah. I mean, it's hard just for us, the
Yeah.
working, person, let alone somebody who's older. So my director takes the cost of our treatment program and she cuts it down to one third. That's how passionate she is about
Yeah.
our
Mhm.
clients getting the services. So she'll
Mhm.
take the total cost and she'll cut it into one
Mhm.
third, and she allows them to make payments to senior recovery so that they can get the help they need instead of one lump
Yeah.
sum. Yeah, so that's how
Yeah.
passionate Mary Selsky
Wow.
is about, our
Mhm.
program. So, and she's tried to keep this going for many years. So I'm very happy to have
Mhm.
her as
Oh, I'm
my
sure.
boss.
Yep.
Yeah.
Definitely.
So, Emily Peterson,
Mhm.
she's our financial person.
Mhm.
She's the one that does all of our
Mhm.
billing, and she organizes our outings and things like
Mhm.
that. Yep. Lene Shansberg, she's our counselor.
Mhm.
She's
Mhm.
new, but she's very passionate about counseling and older
Yes.
adults. And so that makes her a good asset to senior recovery because she really cares about older
Mhm.
adults too.
Mhm.
So we have a wonderful board of
Mhm.
directors. I better name them
Sure.
just so that yeah. So there's
Mhm.
Nancy, Tom, Lorraine, and
Mhm.
Graham, and they're wonderful. They're very supportive of senior
Mhm.
recovery. Anytime that we have issues or we need support, or even just showing up to a speaker meeting, they're always very supportive. All of them. Yeah. And we do have volunteer drivers, which is huge for senior recovery. Older adults really struggle with transportation, a lot of them. Some of them have lost their license, some
Mm.
of them have never
Mm.
drove, some don't have a
Yeah.
car. And so our volunteer drivers will go out and pick everyone up, they'll bring them in, and then they'll take them home when treatment services are over. And that's huge for
Yes.
them.
Yeah.
So many older adults would not be able to come to treatment if they didn't have the
Mm,
transportation.
definitely.
Yeah,
Definitely. Well,
yeah,
that sounds an incredible organization and setup that you have. And what
yeah,
really touched me then was when you said that Medicaid, it just stops. It just stops all drug
yes,
treatment. That's
it does.
that's I didn't realize. I didn't realize that this
Yes,
wouldn't continue past the 65
yeah.
age grade, and that must have a huge issue.
It is a
Yeah.
huge issue. It is, a lot of the treatment centers don't have to deal with that because they don't have too many 65 plus. But once, if they're not low income, if the client is low income, they may qualify for county insurance, like the Rule 25 program or some type of county funding. But if they are over the age of 65 and let's say they have a little bit of money in the
Mhm.
bank, but not a
Yeah.
lot, those are the clients that are struggling because that's a lot of money to come out of pocket with
Mhm.
paying.
Mm.
And so, you're looking at programs that are 20,000, 15,000. I
Mhm.
mean, that's a lot of
Oh,
money.
definitely,
So,
definitely.
yeah,
Wow, and the fact that your CEO takes things down to a third as well, that's incredible.
yeah,
That just shows a lot of passion and a lot of commitment to the clients. That's incredible.
it is.
Wow.
Yep,
So your CEO
definitely.
sounds like an amazing person, that's for sure.
Yeah, she
Yep.
is.
Christine, what programs do you and your team offer, as well as some of the other services that you offer the older community in your state?
Yeah, so we are a 12-step program. However, we incorporate other things into our program also, not just the 12 steps. We do have AA, on-site
Mhm.
AA. So on Mondays and Tuesdays, our clients can come in and
Mm.
our community can come in and participate in our AA groups. We have a wonderful AA leader, Skeeter. He's been with us forever. Everyone loves him, so that's huge. They can really connect with him. We do have an open speaker meeting at the end of every month, which is open to the community. The inner group does post that in their AA pamphlet. And so we provide like some food and we do a potluck, which they love. So we'll have a speaker come in and talk about strength and hope. And then we'll eat some good food, and they just love that because that they bond over that. Um, we do have therapeutic activities also. That's very important for our seniors, where we go out and we do things in the community, like we'll volunteer, or we will have, like, we'll go to museums. They love going to museums. We go fishing, we have barbecues, just a lot of fun things. Movies, a lot of them haven't been to movies for 40 years. And so they really love to do things like that. Yeah.
Goodness
So,
me.
those are kind of the things that we do in our program, and then we do connect with other programs too that offer other support
Okay.
support groups and
Yeah,
things like that.
we'll definitely delve into that later, Christine.
Yeah.
What I absolutely love about your service is you're helping a very almost forgotten demographic in the community. Can you explain to us some of the main issues that the older community faces when they're experiencing addiction?
Oh, definitely. So, some of the main issues that we see come through are health
Yes.
issues. Older adults are having a lot of health issues. Once you reach a certain age, if you've neglected, yourself, or even if you
Mm.
haven't, genetics or whatever it is, we see a lot of people that are struggling with like high blood
Mm.
pressure or
Yeah.
diabetes, just to name a
Hmm.
few. Some have neglected their teeth or their
Hmm.
eyes for all these years. Some are having memory
Mm.
issues.
Yeah.
Pain is a huge
Yes.
one. Think about,
Yep.
knees, back, shoulders.
Hmm.
Yeah, I mean that's us,
Oh yeah.
right?
Mm.
So, so you got it's hard sometimes to get out of bed,
Yep.
right? And so we see a lot of
Mm.
this, and mental health issues
Yes.
huge
Of course.
too. We see a lot of
Mm.
depression and undiagnosed
Mm.
depression. People who have never been to the had a diagnosis to find out what's going on, anxiety, things like
Yeah.
that. We see a lot of grief.
Yes.
Grief's
Yes,
huge,
yeah,
yes.
I'm going to be moving on to that soon because obviously that's a huge issue for your clients. Just want to briefly touch on something. So, what are the main drugs of choice or substances that you find that your clients are using more than others?
Sure. So we see a lot of alcohol.
Yeah.
So at our treatment center, alcohol is probably 80% of what we
Hmm.
see. It's huge. So you got to think about the age of these people that when they were young, that was a lot of what was available to
Hmm.
them. You know, we'll hear a lot of stories about at age 5, I was trying
Yeah.
alcohol, or age 10,
Mm-hmm.
my parents were having
Hmm.
parties and I was sneaking
Hmm.
alcohol. And so that's kind of what we see
Hmm.
mostly. Alcohol is so readily available now in Minnesota. The uh, the liquor stores are open on Sundays now, where before they
Oh,
weren't.
okay.
And so,
Hmm.
yeah, and now Target has liquor stores too. So our clients go to Target, and there you go. There's the liquor store. So it gets to be, it's readily available for this age group, and so we don't see a lot of other drugs, like we may see methamphetamines here and there, cocaine, marijuana. Yep, those are like the main drugs I'd have to
Okay,
say.
but mostly alcohol. When
Oh
did the
yeah.
rules change about Sunday shopping for alcohol?
It's been now I want to say maybe 2 years
Only two
now.
years.
Yeah.
Have
Yeah.
you seen
Yep.
an increase? Would you say, or more? Has this been more problem?
Oh,
This has been more
definitely.
problematic, right? Okay.
It has been. Yes.
Wow.
Yeah.
Okay.
They don't have to drive to Wisconsin
Right.
anymore to
Yeah.
get alcohol. And then one of the things too that we see that is very problematic now is you can order alcohol in. The liquor stores deliver now.
Okay.
Yeah, and
Hmm.
you can call up and have food delivered, and now you can have alcohol delivered
Hmm.
too. And so that's a huge. Uh, we're seeing this more and more all the time. So many clients are saying, "Oh, I just made a phone call and they dropped it off."
Right.
So it makes it more
Most
accessible.
definitely. Most definitely.
Yeah.
You offer a very holistic approach to treatment. So, what are some of the programs you offer for mindfulness, which is clearly a vital
So,
component of recovery?
yeah, so for us, mindfulness, we do offer like stress,
Yeah.
like relaxation
Hmm.
techniques, like deep
Yeah.
breathing. We offer like mindfulness eating. That's a popular
Hmm.
one. A lot of people don't do that.
Hmm.
Yeah. Meditation's
Yeah.
huge.
Yeah.
Yoga, but it's age specific
Hmm.
yoga. It may not be you're doing a downward dog on the
Yeah.
floor, but we may be standing at our chairs and doing yoga there. Something that, they're able to do. Art is huge. We like to incorporate art, mindfulness. We did mosaic art recently. Also, we did addiction masks. So there's a lot of therapy in that, stuff. So yeah.
Definitely. You certainly cover all the bases, that's for sure. It's just amazing to hear this. It really is, Christine. Um, when we first met, when we first spoke, you explained some of the other issues that you help your clients with, such as completing paperwork and using computers, that kind of thing. Do you work with other agencies in the local community that can help if a client presents with a problem that you don't specialize in, such as housing, financial difficulties, or do you help them directly with other issues in their lives too?
Yeah, so we definitely help with those things. We help to within our scope of practice, but if a lot of times we refer out to like county agencies, there's case managers, Radius Health, the Guild. We also work with peer specialists now. Are you familiar
Yes.
with those?
Yeah.
Specialists. So we work with the Recovery Connection, and we have a on-site. Well, he comes in quite often. His name is George
Mhm.
Green, and he's wonderful. So he does support our clients where if depending on what they need, let's see someone needs to fill out some paperwork for the county or Social Security. He will sit down with them and help them with that. So that's wonderful. Yeah, so we do figure out what the client needs and we help them. If we can't do it here, we definitely connect them with somebody that can. Yeah, because that's very important.
Definitely.
Um, Computer use for older adults, a lot of them like Zoom meetings and things, they shy away from that. They're more old school, I would say, where they like more personal, one-on-one. So they do struggle with, having appointments over the computer. So for the most part, as much as we can schedule in person, we do that for them. So we may get someone to come in and visit them here, and we always provide a space for them to meet with the clients. So yeah,
Something that you mentioned earlier, and obviously something that we talked about when we first met, was helping your clients through grief, which is sadly a bit more of
yes.
occurrence due to your client group. Would you say that grief can be a trigger for addiction when someone has not previously really had a history of problematic alcohol or drug use?
Oh,
Hmm.
definitely, yes. You have to think about the fact that people have, it can be grief over the loss of a loved
Yes.
one,
Hmm.
being with somebody for 40
Hmm.
years and they pass
Hmm.
away.
Huge.
And then also the grief over the loss of, being retired, your sense of purpose, who you were, your independence. A lot of times there's grief over the loss of, I used to be a person that can make my own decisions, and now I've got my children stepping in financially, or you know um, I used to, like saying that, the older adults used to be the caregivers. They were the ones that were the one helping people, and now they're having to be helped, and so that's very hard for them. Plus, the loss of being, having the same friends for all these years and you're starting to see them pass away. I mean, it's a very scary thing for them, and and it's very sad, but we do partner with a lot of places that offer grief counseling or grief support. Therapy is huge for grief support. So we do make sure that our clients are connecting with the proper therapists that will support them and through the grief.
Yeah, yeah, it's
Yeah.
very, very important, and it's something I've never really thought about before. But obviously, this is such an important time in someone's life, and they're going through these changes, such big,
Yeah.
big changes, and addiction
Yeah.
must surely creep in there somehow. And
Oh,
it's
definitely.
just wonderful hearing that your service is available for your clients in your state. It really is. I've not actually come across a service that specialises in this, and it's just wonderful
Yeah.
hearing the work that you're doing. It really, really is. Um,
It is, and I really wish that people would, doing stuff like this with your podcast and getting the word out
mhm,
there about these issues. There's a lot of focus on,
yeah,
fentanyl and things like
mhm,
that, and the things that are going on, with the younger generation, and we're kind of uh, losing sight of the older
mhm.
generation and the things that they need help with and resources for them.
Most definitely,
So.
most definitely. Um, you obviously said that not many of your clients are using opioids, but how's St Paul dealing with this crisis anyway? Because it seems to be the whole country is experiencing it now, sadly.
Yeah, yeah. We actually, for us, so St. Paul is Ramsey
Mm,
County. That's what county we're in right here. Is experiencing a lot of opioid deaths, fentanyl. I believe it was 79 deaths in the past 6 months. I think it was.
in,
So that's quite
in your
high.
county,
Yeah. Yep, and just in my
goodness me.
county, not in. And think about all the counties there are in Minnesota. Yeah, and so that's quite high. And so, but there are a lot of community outreach programs right now, and a lot of medication management. Like we recently had a class on for Narcan, and our clients learned so much from the gentleman that came in. His name was Justin, and he really provided a lot of education for our clients. And he actually brought along Narcan kits, and we all got kits, and he taught us how to use them and everything. Yeah. And so there are a lot of outreach programs in Minnesota like that. Um, yeah, and I know that they're reaching out in the community, like with Catholic Charities, uh, the homeless population, and giving them kits also.
It's such vital work. It really is. I spoke to a gentleman last week who's in your state who started doing Narcan kits around his community, and
Yeah,
it's just amazing hearing how what an impact just these can make alone. Just you were saying about the chap who came in to do the training. That's it's
yes,
vital.
amazing.
It
It
really
is.
is. It really.
And it's very scary because we learned a lot from
Mm,
him about other drugs that are coming into the
mm,
scene now. I think it's a horse tranquilizer, xylazine. I think that is something that our older adults didn't hear about, and they were amazed and sad at the same time because it's like, what are these, this younger generation dealing with, all of these things, and it's very scary. So it's not only scary for us, but extremely scary for them because you never know. One use might be the last time.
It does seem
So,
the risk of drug taking has increased significantly, even in the last 10 years alone. I think really things have just stepped up, and we've now got fentanyl. We have, you were saying the other opioids that are coming in, and my goodness me, but it's good to know that people are reacting to this in a way to help people as well, which is very
right.
very nice to hear. Um,
And I think the
yeah,
education is so
yeah,
important.
yeah.
Yeah,
That's a vital component to any of this. That's for sure. Um,
sure.
Christina, I ask all my guests this question because I always get very interesting and very varied answers. But can you
Sure.
tell me your opinion of harm reduction and how it plays a pivotal role in recovery?
Sure. So for harm reduction, I do believe in harm
Mm,
reduction. I am looking to help the person um, move towards a better quality of
yes.
life. And if whatever we can do to start out with doing that, to minimizing the damages that are happening, even up to
Mm,
death, I am willing to try. I'm looking to meet the client where they're
mm,
at, and obviously the end goal would be abstinence.
of
That's what I
course.
would like to
Yep.
see, but it's not about me. It's about the client, and my purpose is to help try to do whatever I can to support them in any way that I can. And um, we'll set some goals and we'll move towards them, and hopefully we can continue to keep doing that and moving towards less and less. And that's kind of how I see it.
Yeah. I
Yeah,
love what you just said. It's meeting people where they're at. That's
yeah,
that's the key, I think, with harm reduction. That's for sure. That's for sure.
it is
Yeah.
definitely.
Well, thank you for that. Last couple of questions, Christine. Do you have a message for anyone listening to this podcast who's going through addiction or experiencing mental health trauma?
Sure. My message would be, please don't give up.
Mhm.
It's so important. If you do have a relapse, if you've had some sobriety and you have a relapse, please don't give up. Because I feel like these treatment centers and these support groups are where you need to be. A lot of people want to just throw away what they have achieved, um, and in one day. If you have a relapse, please come back. Give us a call. Give your sponsor a call. Don't give up. You will be able to get through this. And I think it's so important that um, you just really stay focused on getting help. Yeah,
Wonderful. Last
yeah,
question. So can you tell our listeners how to best contact you and to find your service online?
sure. So our website is
Mhm.
seniorrecoverycenter.org. And also our phone number is 651-773-0473. My email is Christine at seniorrecoverycenter.org, and I will be happy to help anybody that needs help. Or even if you just want to talk and look for other resources, I would be willing to help you with that. Even other treatment centers, we do provide assessments here for all ages. And so I would do an assessment for somebody, and if somebody needed to do an inpatient or residential program in another treatment center, I would be happy to do that also. It's not just about senior recovery, it's about helping the
That's right.
community no matter what age you
Hmm.
are. Yeah, so that's why we're
Yeah,
here. But you got to make that phone
that's what.
call. You got to call
That's
us.
right. That's right.
Yeah, yep,
Well, Christine, it's
yeah,
been so interesting and a real honor for me to speak to you and to find out about your amazing service that you're providing. It really is. And thank you so much for your time to join me today. And I look forward
yeah.
to speaking to you again in the future.
Yes, thank you so
Yeah.
much, Chris. I really am happy that you gave me a call, and I'm very grateful to
Oh,
you.
well, me too. Well, thank you very much, Christine. You take care.
Okay. You too. Bye.